For the last 50 years, Ebola has remained one of the world's deadliest viral diseases, claiming more than 15,000 lives across Africa. Now, the World Health Organization has declared an international health emergency over a fresh Ebola outbreak in the Democratic Republic of Congo, and that has already killed at least 87 people, while neighboring Uganda has also reported a fatality. However, the WHO has stopped short of calling it a pandemic. Now, when does an outbreak become a global emergency? WHO makes that call by declaring a PHEIC, a public health emergency of international concern. It happens when a health event is sudden, it is unusual, or it is unexpected and actively threatens to cross international borders. Some recent and major examples include COVID-19, Mpox, and the Zika virus. Despite major advances in vaccines and the treatment, the virus continues to pose a serious public health threat. Ebola was first discovered in what is now the Democratic Republic of Congo. The virus was named after the Ebola River located near the site of the first recorded outbreak. Scientists have identified 6 strains of the virus so far. Among the 6 strains, the Zaire strain has been responsible for the most major outbreaks in recent years. Now, experts believe fruit bats are the natural carriers of Ebola. Interestingly, the bats themselves do not fall ill, and the virus can also spread through infected animals such as apes, antelopes, porcupines. This is before reaching humans. Human-to-human transmission happens through direct contact with bodily fluids of infected people, including blood, vomit, and other secretions. Traditional burial practices involving physical contact with victims have also contributed to the spread during outbreaks. Unlike some respiratory diseases, Ebola does not spread through air. However, once infected, patients face a very high risk of death. According to the World Health Organization, symptoms can appear anywhere between 2 days and 3 weeks after infection. The illness often begins suddenly with fever, weakness, muscle pain, headaches, and sore throat. As the disease progresses, patients may experience vomiting, diarrhea, abdominal pain, skin rashes, and even organ failure. In several cases, internal and external bleeding has also been observed. Vaccines are currently available only for the Zaire strain of Ebola. Global health agencies are also testing potential vaccines for the Sudan strain following outbreaks reported in recent years, and doctors now use antibody therapies that have significantly improved survival rates in some cases. Supportive care, including rehydration and blood transfusions, also play a crucial role in the treatment. Now, the deadliest Ebola outbreak in history, it began in Guinea in late 2013, and it spread rapidly across West Africa. By the time the epidemic ended in 2016, more than 11,300 people had died, mainly in Liberia, Sierra Leone, and Guinea. The Democratic Republic of Congo has experienced more than 15 Ebola outbreaks since 1976. The country's worst outbreak between 2018 and 2020 killed nearly 2,300 people. Health officials warn that while medical science has made progress against Ebola, rapid detection, isolation, and community awareness remain critical in preventing future outbreaks.